This video demonstrates the insertion of the Cwjacc with Cwjacc technology using the standard Seldinger approach. You can purchase certain components separately that are shown in this video. The glide-through sheath and the Arrow 80 cm hydrophilic nitinol wire can be purchased separately. The nitinol wire can be purchased under the SKU number PW18080HN. Please note, you must use a .018 cm hydrophilic wire for the procedure, or the Cwjacc protective technology could stick to the wire. You must prime the wire with saline to activate the hydrophilic coating. Prior to insertion, adjust the bed to the proper height. Place the patient in Trendelenburg position. Next, use the ultrasound to assess the vessel. Using the ultrasound probe, assess the patient for the optimal insertion site based off anatomy and potential thrombus formations that may inhibit a successful insertion. Once assessed, measure the distance from the insertion site to the lower 1/3 of the superior vena cava for optimal tip placement. As part of any Cwjacc prevention bundle, using a chlorhexidine-based skin prep is recommended. Be sure to apply the prep for 30 seconds using a scrubbing motion to create friction. Allow the proper time to dry per the manufacturer's instructions for use. Prior to insertion, place your needleless connector on the jack and flush the lumens. Deploy the maximal barrier precautions drape to ensure proper sterile technique is followed. Using the ultrasound, identify the vein. Insert the insertion needle and aspirate for blood return. Remove the syringe from the insertion needle. Place your thumb over the open end of the needle. Dispose of the aspirated blood into the hemohopper fluid receptacle. Feed the wire into the back of the needle. Remove the needle. Remove the dilator from the sheath dilator assembly and dilate the skin tract. Remove the dilator. A skin nick is not recommended as it can cause unnecessary bleeding at the insertion site. Place the distal tip of the jack over the wire and advance it into the patient. Aspirate the lumen to ensure proper blood return. Note, because the Cwjacc technology is antithrombogenic, you should apply pressure to the insertion site for 2 minutes until hemostasis is achieved. An internal jugular line can be more comfortably dressed on the chest. By leaving a few centimeters out, you can easily dress the catheter in this manner. Start by applying an antimicrobial dressing to the insertion site. As an option, to control the catheter's movement, you can use the second site securement. Next, apply a sutureless securement device for stabilization and additional patient comfort. The catheter can also be sutured into place if desired. Finally, apply a clear semi-permeable dressing to the insertion site. Remove the drape using the Easy Tearaway feature. Some patients may need a pressure dressing to achieve hemostasis at the insertion site. Typically, the pressure dressing can be removed after 24 hours. For more information on the Cwjacc with Cwjacc technology, please visit Cwjacc.com or contact your Arrow Vascular sales representative.